good afternoon, everyone. I'm Sharia Harris Turner, the Director of Communications for the Housing Authority of the Birmingham District. And I would like to thank you for joining us for this first of a series of a Facebook Live conversations as we deal with this COVID-19 pandemic in our country. The title of today's event is COVID-19 and its impact on the Black community, a conversation with health experts and faith leaders. Now, this is a collaboration between HABD and UAB. This discussion is being recorded and will be available on the UAB School of Public Health's YouTube channel a little later. Now, I would like to start by introducing the panelists that we have for today, and they are Dr. Selwyn M. Vickers, medical doctor and dean of the UAB School of Medicine, Dr. Christopher M. Hamlin, chaplain and education specialist at the UAB's 1917 clinic, Dr. Thomas Beavers, pastor of New Rising Star Church, and Dontrell Young Foster, the interim president and CEO of HABD. I will now turn things over to one of our moderators, Dr. Faith Fletcher, assistant professor of the UAB School of Public Health. Faith.
Thank you, Sharia, for introducing this series. I also like to highlight that this will be co-moderated with my colleague, Dr. Shantice Allen, who's an assistant professor at UAB in the School of Public Health. So we expect this to be a series of conversations with different experts speaking on educating our communities. Essentially, we want everyone to remain safe or to stay safe during this crisis. So in the midst of this crisis, there have been several people in the community who are working on the ground day and night to support our families, our patients, and our communities. So this is a discussion today with those people, and we'll highlight their work, hopefully to gain additional knowledge to really equip us with the resources that we need to stay safe during this pandemic. The first half of this conversation will be about health with Dr. Vickers, and the second half, moderated by Dr. Allen, will be about faith and community. So right now I'll allow Dr. Beavers, he's gonna offer us words of encouragement to really talk about his reflections related to COVID-19. And we're happy to have him. He's been a leader, a spiritual leader, and a source of inspiration for us during this pandemic. So we thank you.
Thank you so much, Faith. I'm honored to be here today. I want to begin with a word of encouragement. All of us know we are in the middle of this COVID-19 crisis, and the world, in essence, is on lockdown, or should I say, rather, we are on lock-in. And I just want to encourage everyone that's listening, everyone that is watching, to take advantage of this opportunity. Don't see it as a problem, see it as an opportunity, and seize the moment. All of us have been blessed with both the gift and the curse of technology. The gift of technology is that it has sped up the world. The curse of technology is that it has sped up the world. And as a consequence, because the world has sped up, our attention spans have become shorter. And we really don't take advantage of the time that we have together as a family. So while everyone is staying at home, please do not see it as a problem. See this as an opportunity to seize the moment, to spend more time with the people that you love. I know that me personally, I've had the opportunity to eat dinner with my family more than I have on previous occasions. I should have been doing it a long time ago. I've had the opportunity to spend more time with my family, to play with my children, to actually interact with my children, to actually be around my children. And I believe that as a pastor, God instituted the family before he instituted the church. Strong families make up strong churches, but we've attempted to make the church strong without strengthening the bond of the family unit. And so really, this is an opportunity for all of us to go back to our first ministry, and for all of us to go back to our first love. And stay at home and spend time with our family, strengthen those relationships, because we never know when we will have this opportunity again. In closing, I'll say this. I don't want things to go back to normal. I want things to move forward to a new normal. Sometimes God allows things to take place in order to have a divine disruption. And I believe that God wants to move forward to a new normal. And this is the opportunity for all of us to create that and see what that looks like for everybody. So stay at home, spend time with your family.
Thank you, Dr. Beavers, for those words of encouragement. And again, thank you for being here. Thank you to all of our panelists for being here today. So we're going to get started. Dr. Vickers, we have some questions today, some burning health questions that we would like to talk to you about. So we're discussing COVID-19 because it's new. It's something our world hasn't seen or experienced before. So how is this different from the flu, and how can the public be proactive during this pandemic?
So there are similarities to the flu, and yet there are pronounced differences. The similarities really relate to the really high infectivity, in that for every one person who has coronavirus, they will have the capacity to infect 4 to 5 people. Like the flu, the major area of transmission comes from the back of the throat and the lungs and your sort of respirations, the air that you breathe. That's probably one of the highest sources, but the virus certainly can live for 24 to 48 hours on different surfaces, so you can pick it up that way as well. Like the flu, most people do get well and get over it. But to your probably surprise, we lose about 60 to 70,000 people a year who have very bad influenza. So they'll get the flu and you don't think about it, but across the country, across America, in general, nearly 60,000 people will die from it. This virus is different for a couple of reasons, and we have some drugs that work against the flu, and it's recent. The Tamiflu is probably the most common one we see once you've truly been diagnosed with it, and it's effective actually. But as it relates to this virus, what makes it so difficult, number one, is that there is no therapy we have right now. And there have been a lot of ideas about what might work, and there's a lot of clinical trials that are going on. In general, there's a drug that was helped design at UAB that's been tried in China, now is in trials here in the United States, called remdesivir. And then everybody's heard about the drug, may have heard about the drug called hydroxychloroquine. It's in the more, I would say, layman's terms, called quinine. It's been given for people who are traveling overseas in areas where there is a high risk of malaria. And it also is used for people now who have lupus and who have rheumatoid arthritis. It helps with their inflammation. So those drugs potentially have benefit, but we have not proved it yet. We are using them, but we don't know that they actually will work yet. And so we haven't used them broadly because, like any drug, it can really have a side effect. The final difference is this virus will kill significantly more people than influenza. It will do that because of where it infects. Most of the flu infects your upper airway, and eventually it stays there. Most often it stays there, but on some occasions it goes deeper in your lungs and you get a difficult pneumonia. But this virus, unfortunately, is different by a couple things. Number one, the basic symptoms are typically a dry cough, a fever, and shortness of breath and fatigue. So you really notice, more so than any other flu you get, this virus makes you feel like you can't get your air. And that's because the virus infects the lower respiratory cells in your airway, not the upper airway. It infects the lower part of your airway. And in that process, when you get it early on, it automatically causes a pneumonia. You don't have to get it, it doesn't have to get bad to cause a pneumonia. It typically starts with a small pneumonia, and that's why so many people get intubated. So at UAB, we have about 60 patients in the hospital who have the diagnosis of coronavirus. If we had in this season, 100 patients with the flu in the hospital, maybe 100 with 100, maybe 5 or 10 might be on a breathing machine. With the 60 patients we have in the hospital at any given time, nearly half of them are on a breathing machine, nearly 30. So it really has significant ability to damage your lungs It has a significant ability to weaken your body once you get very sick and require ventilation, which is a very invasive procedure, and therefore increases your risk of dying. So consequently now, there are a number of deaths, well over 60,000 deaths in the world. There are 8,000 deaths in America, and those numbers will continually climb.
Thank you, Dr. Vickers, for that information. That's very helpful. So based on what you're saying, there's no proven treatment at this time for COVID-19. So what's the best method for us to protect ourselves and others from getting COVID-19?
So it's unfortunate that we can't give everybody a tablet and a pill to make this go away. And it's unfortunate that we don't have a spray that we can spray in your house to make it go away. So what we're left with things that seem to be crude and a little bit awkward. But in reality, from what we've learned from other places, the ability to make a difference in this virus is clearly related to a set of things that the healthcare world needs to do and a set of things that the community needs to do. On the healthcare side, we obviously are going to do all we can to find treatments, and there are millions, billions of dollars now put in place immediately. Many of you may not have been in the era when HIV first became an illness. And as a young physician, I must have been tested probably 100 times for HIV because I stuck myself so many times. But each time I stuck myself, I basically saw my life flash before my eyes because there was no treatment. And once you got it, you were certain to die. This virus is not automatically lethal like HIV. The vast majority of people will do well. But because it's so infectious, many people will still die. So we'll do our part about developing drugs. And I think we will, before this is over, we'll find something to treat it with, but we don't have it now. The other thing that we have to do, and we just didn't know and didn't have the numbers in mind, but we need testing. Because in general, obviously, if you have a dry cough, you can't get your breath, and you have a fever, you should get tested for COVID-19. Those are good signs. But probably if you test only people who have those symptoms, probably you'll miss 40% of the population. So there are a lot of people who have no symptoms that are carrying COVID-19 around. They don't have any problems, they don't have any breathing issues, but they are carriers of the virus. And we don't know who they are because we don't have enough testing to test everybody at this time. So on the community responsibility, it's really then limiting the spread of the virus. And obviously areas that have high density and a lot of people together suffer, like New York. And New York leads the country now with over 100,000 people infected and nearly 4,000 people who have died, and many have been doctors and nurses. So you obviously know if we had an automatic bullet to treat someone, we would give it to the physicians and nurses, and we don't. So keeping a distance is really important. And that distance of 6 feet is based on how far someone, when they speak or accidentally spread their aspirations, it's about at a 6 feet window, and that's why that's recommended. You could even do 8. Secondly, you then certainly need to think about covering your mouth. Not so much that you can't get it, but if you don't spread it because you may have the virus and don't know it. So covering your mouth, it can be a cloth mask, it can be a scarf, it can be a regular, hospital mask if you have them, except I would say the hospitals need them desperately. But any cloth mask you use, you should use that now in order to limit the amount of transmission from your mouth. There was a recent study done out of Seattle, which was very concerning, and they were just rising in the height of their viral pandemic in the state of Washington, and they were still having church. And in this scenario, a choir of 60 people got together and they sang. But before singing, they washed their hands, they used sanitizer, they kept some distance from themselves, but all 60 choir members got infected and 2 died. And it just highlights the power of when you're speaking a lot, when you're singing, you can infect people pretty quickly. So staying out of public gatherings of any significant number, that's less than 4 or 5 if you would, and I think it's told 8 to 10, but small numbers as you can, keeping a distance, covering your mouth and nose with a mask, and I think trying to make sure every time you touch something, clean your hands. When you pick up something, when you go outside, when you get groceries, quickly come back and use soap and water, which is better than any hand sanitizer, to clean your hands for about 20 seconds. So do that. And then when you know people who have some symptoms, try to make sure you stay away from them and give them space to actually quarantine or to be isolated.
Thank you, Dr. Vickers. So you mentioned respiratory symptoms. So for those of us who don't have a medical background and don't know how that feels, can you describe how severe respiratory symptoms might feel so that folks can know when they need to take action?
Yeah, so when people have contracted the virus, the early symptoms, again, are you feel tired, but you'll have a fairly high fever, usually as high as 101 degrees. So it's high and you feel exhausted. Now, the problem is there are a lot of other infections that give you somewhat of similar feelings, but typically not a fever that high, but you can certainly get a fever from a lot of other things. But a fever that's usually higher than 101, you feel fatigued, and then over some short period of time of hours, usually over a night, you will begin a cough. And that's the earliest respiratory symptom because you have an irritation in your airway and you cough constantly. The second is, the third of those, if you would, or the fourth of those, is that you really now feel like you can't get your breath. You feel short of breath. You can breathe, but it's harder. And that, when that gets significantly worse, where you feel you really can't walk very far, or you feel like you're losing your breath, you clearly need to go to an emergency room or a hospital. Many people will have the cough and the fever and just feel tired and a little short of breath and are fine, and they'll do fine at home. But when you progress to a degree that you really don't feel well, and that is you can't feel like you can get air in your lungs, you clearly need to go to the ER or hospital. And maybe even earlier if you have diabetes, if you have renal failure, or you have some heart disease. That makes this much worse if you have those areas. And it concerns us because so many people in Alabama have those diseases.
Thank you. And that was actually, that's a perfect segue into the next question that people have asked about. So what does it really mean to have a chronic illness or to have something that reduces your immune response? Can you give a little insight about that?
Yeah, so it's many of us will have something that we're treated for. And because we're living with it, we don't see it as a disease or a limitation. And so sometimes these labels, we don't know if we fit into that category. You're doing your regular job, you live in your life, you take your medicine like from your world, like everybody does. And so the term chronic disease, you don't normally see that as a category that you live in and that you exist in. I mean, you're living a normal life, so you're not burdened by those labels, hopefully. But what it does mean is that if you have anything that you're being treated for that doesn't go away, right? So if you have hypertension, for example, or if you have an enlarged heart, or if you have some heart failure, you may be able to function and do well, but that doesn't get cured. So if it's not cured, you're living with it. You may have diabetes, and you may or may not take insulin or metformin or some other oral drug, and you live fine as you manage your life, but it's not cured. You live with it. You might have been told by your doctor that your kidneys don't work so well, but you're still going to the bathroom regular and you're still doing your regular business, but it's not cured. That's something you're living with, and that's chronic. You may even be on dialysis and you're living fine, but it's not cured or going away. Now, if I have an infection in my thumb and I get antibiotics, that infection is cured. It's gone. It's not chronic. and that's over with. But these illnesses, you take medicine for to manage them, but they don't ever completely go away. What they do because you live fine until you're put in a highly stressful situation. And this virus stresses your body at a level that's not normal. And so the people then who have greater risk with this virus is when some part of their body is going to be stressed significantly more than just their normal daily life, and they don't have the reserve and all the extra ability to fight it off because of those illnesses that they're being treated for and they're living with.
Thank you. So here's a question that comes up a lot. So let's just say younger people, for instance, who may not have any symptoms, can they infect other people with COVID-19?
Yeah, so what is observed about who gets this virus, there's certainly the concept and some people's idea is, do African Americans get this? Do Black people get it? The other group is, do young kids get it? Children's has already had their first case. So kids can get it. And young people have died from it, less than 20, 16 and 19. And we've had a young person at UAB have it. Kids probably more often are carriers. They don't often get very sick, but they carry the virus and they can spread it. Certainly not by any intention, and certainly by the case that we often don't know they have it. So people clearly can have it and carry it. I will tell you, just so people understand, what is emerging is that in our larger cities, and I'll give you two for an example, Milwaukee and Detroit are probably the most prominent examples because their states count not only the people who get the respiratory infection, but they count who they are and where they're from. That is, they count whether they're African American, Latino, white, or something else. In Milwaukee, which is 26% African American, 50% of the COVID cases happen to be African American, with only 26% of them being the normal resident number. The other astounding statistic, although you have another 50% of the people who are white or Latino who get it, and 50% who are African American who get it, 80% of the people who die are Black. So,
why is that?
You can hypothesize that they may have some of these chronic illnesses.
Okay.
You can also you also can worry that they just don't get access. They don't get to the hospital as early. And so it's probably multiple reasons. And in Detroit, where only 14% of the population, I should say in Michigan, where only 14% of the population is Black, again, nearly 35% of the cases are Blacks, but even more concerning, with only 14% of the population being Black, 40% of the deaths are Black. So not only can we get it, but when we do get it, we tend to do much worse.
Okay, well, I'm going to move to my final question so that we can, I want to make sure we have adequate time for the faith and health aspects. So can you talk a little bit about hospitals becoming overcrowded at this time and what that means for people who might have issues that are related to COVID and non-related to COVID?
Yeah, so I think in certain parts of America, particularly as I talk to my colleagues in New York and New Orleans, it's nothing like you can imagine. It's worse than Katrina. The hospitals in New York, one hospital has over nearly 2,000 patients across their system. They have 5 hospitals. They have nearly 2,000 patients admitted with coronavirus and nearly 500 on ventilators. And in New York, if you do not, which people may have heard, if you have some other illness that appears to be life-threatening, like a heart attack, it becomes a very difficult decision. Do they take you to those hospitals? Because they don't have ventilators to put you on. So sometimes people who are older may not do as well just because there's not access. Fortunately, in Alabama and Birmingham, that's not the case. We are planning for a greater increase in number, and we've given ourselves plans to really take on a large capacity. right now, we have 60 patients in the hospital. We have 30 on ventilators, and we have plenty of beds for people who need that care and need that space. It does tax our ICUs, but we still have plenty of ICU space if people need it. Probably the biggest effect that doesn't go away, depending on whether you have one COVID virus patient or 1,000, is the risk of healthcare workers getting infected. And that still is problematic. Our physicians and nurses are in many ways in a frightening environment because they are trying to serve and keep someone else alive, and yet they know they put themselves at risk of getting infected. If you're not around a person with the virus, you probably won't get it. But if you're in the hospital directly in contact with that person trying to take care of them, you have a higher risk to get it. Now, you don't automatically get it just because you come to the hospital, but those providers have a significant risk. Even though we don't have New York's numbers, we still have our providers who've already gotten infected with the virus. And fortunately, no one has passed from it, but there have been many who have had that happen in New York City to see their colleagues and their friends not survive.
Thank you, Dr. Vickers. Thank you for your time today, and we appreciate you and all of the other healthcare providers who are on the front line serving our patients in our community. And thank you for this information and equipping us with the knowledge that we need. So there's two key resources for people who have logged in today. Alabama COVID-19, there's a 24/7 testing hotline. So information about testing, 1-888-264-2256. We'll have this on the website. But general COVID questions, you can direct those towards 1-800-270-7268. Thank you. And I'll turn the rest of the segment over to my colleague, Dr. Shontice Allen.
Thank you, Dr. Fletcher. I want us to really kind of marinate a little bit on what Dr. Vickers shared with us in terms of those staggering numbers across some of these other cities. And just to really very quickly quote Dr. King, Martin Luther King, he once said that we're caught in this inescapable network of mutuality, but we're tied into this single garment of destiny. And what happens and affects one person directly impacts all of us indirectly. So Pastors Beaver and Hamlin, and Dontrell also, I have a question starting with the pastors first, and Pastor Hamlin, I'll hand this first question off to you to start us off. Churches are natural social gathering places for communities and for individuals. And just starting with you and then turning it over to Dr. Beavers, can you both speak to your current experiences with alternative ways that you're engaging your congregations during this time?
Thank you, Dr. Allen. It's good to be a part of this discussion. I pastor Tabernacle Baptist Church in Smithfield, right, our property Buttress Legion Field. And fortunate for us, we did a renovation a couple of years ago and took technology into consideration and upgraded. So we were have been able to do a virtual worship service that we provide for our members. Before coming here for this, my small team was in the sanctuary taping the virtual worship service that will go live in the morning. And so I think churches are having to explore new possibilities and new ways in which to minister to people in ways probably most of us never thought we would have to do. And I'm sure Pastor Beavers would agree with me that this is all about technology and staying connected with your people any way that you can, whether it's a conference call, live worship service, Zoom. A lot of us are using Zoom now, and other ways of just staying connected. The term that continues to be used that I particularly don't like is social distancing. And I think we are physically distancing from each other, but it's so important for us to stay socially connected and spiritually connected. And I think as pastors and religious leaders, we're just exploring all kinds of ways to make that happen.
Pastor Beavers, what you're doing at the Star?
Yeah, so this is one instance where technology is a gift and technology is a blessing and we can use it to our advantage. So one of the things that we have been doing, or a few things that we have been doing, is that every single morning at 6:30 a.m. Central Standard Time, we have a prayer line that goes live on my Facebook Live page. And those that are not on Facebook Live, or those that don't use social media, you can actually dial into the prayer line. Anyone is able to get a free conference call phone number, and become a host of a free conference call line. And so some people are actually dialed into the line, and then some people actually watch it and view it live via Facebook Live. So that's been a tremendous blessing to us, because not only do we pray, but we share a word of encouragement every single morning. And we also give announcements and updates and keep everybody updated as to what it is that is going on and how it is that we are moving. We also have a mass text messaging system that has been a blessing to us. Anybody can text star to 94253 for up-to-the-minute updates and up-to-the-minute information of things that are going on concerning our church and concerning events that we have. And the beautiful thing about it is that we were able to build this mass text list over years. And so we have a little over a couple of thousand people on the text list, and it grows every single day, especially since COVID-19 has been going on. It's grown even more, and I've been encouraging people to make sure that they get on the text list, because things are changing on a dime. You know, you put out one piece of communication today, and then we hear something from the CDC and something from our health experts, and then immediately we have to be able to change just like that. And so the text list enables us to do that. Also, the gift of being able to stream our services has been a tremendous blessing to us. We're able to stream our services on Sunday mornings and stream our services on Wednesday nights. And being able to maintain a form of physical distancing and not having a large number of people in the room, but specifically just the people needed to be able to stream the service out to the people. And so that's been a blessing to us. So we've been doing things like that. And fortunately, we've been able to stay connected. As far as giving is concerned, salvation is free, but it still costs to do ministry. And one of the messages that I've had to convey to our church and even to other people is that the church was never the building. We who are the church go to a building every single week to worship. As a consequence, the church is not shut down, the building is shut down. And so ministry must move forward. And so, you know, it costs to do ministry. So we have 6 different ways that people are able to give. People can give through cash and checks as they normally do. We tell them to mail it in. People can give online via the website. People can give via text. People can give via Cash App. People can give via Venmo. And so we've just been trying to do our part. It's a new challenge for all of us as pastors. No pastor has ever pastored through a crisis like this. So once you get over the initial shock of what it is that you can and cannot do and how things are rapidly changing, I think the key is not to operate in fear, not to operate in anxiety, but to really see this as an opportunity of how we can all get better and how we can all serve people well and love people well during this time.
Thank you, both of you all. And I'm hearing, you know, all of these numbers of ways that you're engaging your congregation. Dr. Hamlin, do you have another comment?
I was going to say, churches, especially churches who have not had the ability to create technology to serve their members. I was listening to something yesterday. We were talking about small businesses, especially in Birmingham, that if they don't have capital or surplus, many of them are really being challenged by what is happening now. And the same thing is going to happen to many of our churches who may be small or mid-sized, who may not have, as Pastor Beavers was talking about, a way in which members can give digitally. And they really are going to hurt. I've talked to several friends who said, no, I don't know how I'm going to survive this other than members mailing contributions to the church. They may not have another way of doing it. And I'm grateful to some pastors who reached out to others and said, let's help our sister churches figure this out so that they can survive. As some small businesses are going to fold, unfortunately, I think this same thing may happen to some churches because they just can't survive in this kind of environment that no one was sufficiently and adequately prepared for.
Yeah, right. Thank you for that. So this question is actually directed to to all three of you, Dontrell, Chris, and Thomas. You know, Dr. Hamlin, Dr. Beavers, your churches are located in close proximity to a couple of the Birmingham Housing Authority's properties, which are Smithfield and Marks Village. Would like to hear from you both in terms of your understanding of the community's response to the pandemic, and what needs and priorities do you see your churches meeting? And then Dontrell, for you, in your leadership role as the interim CEO of the Housing Authority, how are you and your team working to address the importance of physical distancing during this time? And actually, I'll let Dontrell answer that question first, and I'll come back to the pastors.
Thank you, Dr. Allen. So one of the major concerns that the Housing Authority is having is getting the information out to our residents in regards to keeping them safe, what they need to do. Are they getting the information that we're sharing with them? We are actively working with many partners. We're working with other public housing agencies and associations. We're working with our local HUD field office, of course, UAB, the city of Birmingham, and we're receiving on a daily basis, we're receiving information that will benefit our residents. And so our concern is the residents receiving this information. You know, a lot of our residents are not actually technology savvy, so we're trying to find ways to get the information out broadly. Some of the things that we're doing, we have like the text alert that we're getting out to our residents. We're using our website to post information that's shared to the residents. We're using our social media platform, Facebook, Instagram, Twitter. And so those are some of our technology that we're using to reach out to the residents. But what about those that doesn't have the technology that we're speaking about? So we have, even though our HEB offices are currently closed, our communication is still there. Our management offices are still open from 8 to 12. If residents have request information, they can reach out to the staff during those times. We also have drop boxes that are outside of all of our management office. If you have information that you need to get to the management, if you have rent you need to pay, you have change in income, you lost your job, and you have any concerns, you can provide the information to those drop boxes, share the information to us so we can know how to assist you and get information to you. We have assigned staff that are making daily phone calls, courtesy calls to the residents, asking them, you know, are you okay during this time? What resources can we provide to you? You know, and we're needing your feedback. We're asking the residents to please do self-reports to us. Let us know if you have an illness. Let us know if you're being quarantined at this time. This information that we need to know so we can know how to share those benefits with you. Again, we're doing a partnership with the city of Birmingham. One thing that we're doing is they have a call center. And what this call center does is we have over 10,000 families, and we can't reach everyone every day. So what they're doing is they're assisting us to making calls to these residents, pre-screening them, providing free resources to them. There are individuals that need transportation to testing centers. They're providing their transportation services to them. We're working with Minority Health and Health Disparity Research Center. What they're doing is they are an anchor partner with our Campus of Hope, which is located in Marsh Village. And what they're doing is they are placing over 100 custom educational yard signs, and they're placing those yard signs throughout our community to share the guidelines that CDC and your local and state departments are providing to us. So we're receiving this overwhelming information from all of these partners, and they're providing resources to us. We're reaching out for resources. And so we want to ensure that our families, the citizens of Birmingham, which includes our public house residents, our Station 8 participants, we want them to receive this information and know that they're receiving information. So we're requesting feedback from them so that we can know that we're serving them to the best of our ability.
So that back and forth communication is really important. We've got over 500 folks on this live stream right now. So Pastors Hamlin and Beavers, just wanted to ask you guys again, what are you hearing in terms of needs from folks who are nearby your church? What are some things that you all are hearing, and how are you working to meet those needs?
Just before coming here, I was at Tabernacle, and a guy knocked on the door, someone that we've serviced before and lost his job last week, needed food. He doesn't have utility service on at the time. So canned goods and that kind of stuff that need to be warmed and heated, even if in a microwave, was not going to help him. So, I mean, those are the kind of stories you continue to hear even before the virus, but they're escalated now. And you just try to find ways to make it work. Our people are unfortunate in terms of what we do in terms of volunteer Meals on Wheels, weekend backpack projects that we participate in, volunteer at a community food bank, at Firehouse Shelter. Those things are now we're unable to do. So we're finding other ways and other agencies who are still on the front line. We're partnering with GBM and the weekend backpack projects that we can't give to a school that we support. All of those baskets are now going to go to GBM for distribution to those who are in need. So it's still finding partnerships and ways to make it work, even though your volunteers cannot be out doing what they traditionally have done.
Dr. Beavers, what's going on on your way?
So I concur with what Dr. Hamlin just said. You know, food and utility assistance are huge needs in our community. And quite frankly, they've always been huge needs in our community, but the needs have ramped up now since COVID-19 has taken place and just put a shift to everybody's normal, or what everyone perceived as normal. And so one of the things that we have been able to do, we were actually doing before COVID-19 started. And so every Wednesday before COVID-19 started, we would have 2 Bible studies. We would have one at 12 noon and one at 6:45 p.m. And at 12 noon, we would always give away food boxes every single Wednesday to the first 100 people who showed up in need of food. And now that we are not physically meeting anymore, we have moved the food box distribution to a drive-through line where we have a select group of volunteers maintaining physical distance with rubber gloves on and with masks on, and people who need food every Wednesday at 12 noon, they can come and they can actually drive through. Nobody gets out of the car, and somebody will greet you, and the food boxes, they'll just hand it to you and put it in your car and allow you to go on about your way. And so that's one of the things that we were doing to service the needs of food. As far as our seniors, we don't want them out of the house at this moment. We really don't want anybody out of the house. But for those who can get out, that's what we do. But as far as our seniors, or anybody who's elderly, you don't have to be a member of our church to receive these services. Anybody who's in need, we want to love our community well and we want to help them. Seniors, just call us, give us your address, and we will be sure that we drop it off at your doorstep.
Excellent, thank you. I want to shift to my last question before we open it up and look at some questions that came in from those who are online, as well as a few pre-questions. I want to talk about a sensitive issue connected to and related to COVID-19, which is illness, death, and dying. We certainly know that COVID-19 is front and center, and obviously because we're having this conversation, but how do families begin to cope with changes in funeralizing their loved ones that may have died from natural causes, not even COVID-19, or some violent act, when the natural response is to physically cling and comfort each other? And we know that right now we're talking about physical distancing, but not socially isolating ourselves from each other. But how do you reconcile those two things when it comes to illness, death, and dying?
I think that is, that's very challenging for families, especially. We've had, since this pandemic hit us in Alabama, we've had 2 deaths tethered to our congregation. And both persons were cremated, which is something that African Americans for some time were just not prone to do, but more of us are now open to that. One's ashes were scattered in the Atlantic Ocean, which was her request, and the family, her children were able to do that successfully. The other you know, they're going to plan memorial services, and unfortunately right now you can't even begin to say when that might happen. So I think Pastor Beaver says this is a new normal, and you try as best as you can to minister to those families, to be with them. And again, you're still somewhat limited because of the physical distancing, especially those who may be older, and you don't want to compromise what, as Dr. Vickers was saying earlier, what chronic health situation they may be addressing and dealing with. So it's difficult. It is really a difficult situation on top of situations. And I think, again, all of us are really just trying to figure this out and try to, again, be present for our members in ways that is make a significant difference in their lives.
I can concur. This is very sensitive. This has affected me personally. My grandfather, Dr. Tommy Chappelle, was the third and longest tenured pastor of New Rising Star Church. Our church is 56 years old, and 56 years we've only had 4 pastors. He pastored for 35 years from 1975 until May of 2010. When he came to the church, we had maybe about 43 members. When he retired as pastor, we had maybe about 1,500 members on the roll, and an average attendance of maybe about 600, 650 people. And so many wonderful things were, you know, done under his tenure, under his leadership. We were able to build our Family Life Center and pay cash for it. A credit union was started, you know, under his ministry. A learning center was started under his ministry. And you would think that for somebody like that, for him to have transitioned from earth into eternity, what I would consider a legend, definitely inside of our city. He was quiet and conservative. He would never say he was a legend, but he deserves a grand, grand, grand celebration. Well, he transitioned on March 25th, 2020. My grandfather is my heart, and so we had to be really creative on yesterday in how we did his celebration. So I believe that we did something that has never been done in the history of the world. We pre-recorded his funeral service. And so his funeral service was on yesterday, Friday at 12 noon. We actually went in on Tuesday night and pre-recorded it. So we had the section of people who would do music and who would actually play instruments. They came in and did their part. Section of people who would sing, they came in and sung over it and they did their part. The people who read the Old Testament, New Testament scripture, they came in at a time, they did their part. The people who gave reflections, they came in at a time, they did their part. I did the eulogy, my uncle did the eulogy, and we pieced the whole video together as a video. And on Friday, when the 10 people from the family came in, I almost get choked up talking about this because, you know, he had 4 children, his wife, his sister, even as his grandson. As inseparable as me and my grandfather were, I was not able to be in the sanctuary. As inseparable as me and my grandfather were, during his last days in the hospital, I was not able to get to him. I was not able to go see him. And so, you know, it was definitely a change, but the 10 people came into the sanctuary and we ran the video for the 10 people who were in there. And what we also did was that we set up a park and watch. And so we put LED video screens on the outside where people who wanted to, they could drive in and they could actually watch the service on the screens on the outside. And then last but not least, we had a stream experience as well for people who just wanted to stay and watch it from wherever they were.
Wow. Wow. You know, you thinking about that from the perspective of family coming together, having an opportunity to really celebrate the life of this individual, and what you just shared and described is the reality of where we are right now. And thank you for sharing that, Dr. Beavers. Dr. Vickers had a quick comment, and then I want to take some questions from the live feed that's coming in.
From the physician perspective, I echo what Dr. Hamlin and Dr. Beavers has shared. Almost in all occasions, maybe there are some rare exceptions, when someone is either suffering and there's probably no symptom more than feeling like you're short of breath that makes you feel like you could die, than what occurs with the coronavirus, as well as being put on a respirator where you're completely paralyzed and sedated. In those most critical settings, 90% of the time, somebody is in your room around the clock who's a loved one, or someone is in every 4 hours coming in to stop in and hold your hand, who's a loved one. So people who die of coronavirus, unfortunately, to some degree, die in isolation from their families. And it's hard to convey a message of someone's passing over the phone. And it's hard for people who call in hoping to hear that my loved one is better to be told, no, they passed over last night and they didn't know. So that's the social side of this that makes it even more difficult, is that as people suffer through this in their process of even getting better or of dying, they're not with their loved ones. And there are certainly caregivers trying to take care of them, but certainly not sitting around them as much as they might normally would in order to avoid getting infected themselves.
Thank you. Thank you for that. Thank you for all of you all for being a part of this conversation, this important conversation. And I want to, before we open up the opportunity for Q&A from the feed, as well as we had some questions that came in, just would love to get a couple of closing remarks, Dontrell, because I've got quite a few questions for you that are coming in from residents. But just how do we as a community work together, stay together, encourage each other during this time? Dontrell, I'll let you answer that question, and then the pastors.
The biggest thing that we need to do is be neighbors, protect our communities. The important thing is there's a new ordinance out now saying stay at home. Follow that ordinance, stay at home. If you don't have to go out, do not go out. Understand there are some essential needs that cause you to have to leave your home at certain times. But again, that's the biggest things we can stress to you. We are pleading to you, follow the CDC local and state health guidelines, because those, just hearing what Dr. Bicker said on this webinar just alarms you in itself. You know, all the things you've been hearing in the past, this is so real. It is so important that you follow the rules that they're giving us, you know, this physical distance. We're providing resources like we spoke about the youth feeding program. The Housing Authority is doing that through an organization called Kickstart. When your kids go out daily to get those lunches, tell them to return home immediately. You know, don't stand around and just see what's in those boxes. You know how kids get together and want to enjoy their families. Just you can do that inside your home. So the biggest thing that we're telling you to do, just stay positive, stay focused, stay connected. You know, if you stand living beside a senior citizen or elderly and they're not receiving this technology information, pick up your phone, give them a phone call, share the information with them. You know, we're sending out direct mail. You know, I know there's a lot of scam that's going out, and some people don't like to touch the mail that's come through, but this is important information, needed information to know to keep you and your family, your neighbors, your community safe. And so before we close, I would like to ask you about Director of Communications, Sharia Turner, just to share some information that we have, such as our text alert information, so that they know where to go to receive this information moving forward.
Sure.
Yeah, thank you so much, Dontrell. And, you know, I just think for our residents, I truly want each and every last one of you to know that we are here for you. A lot of this is hard. A lot of us have fears and concerns and worries, and we don't want any of our residents to think they're going through this alone. We are there for you. We have many resources that are available for you. We just want you to be aware of them, which is why we do want you to look out for the phone calls from our community center staff. They're making courtesy calls for you. So when you speak to them, if there's something you need, let them know. So that way they can put you in contact with one of our many resources that that can help you. Because I know lack of food is one of the biggest things that I know is becoming a problem for our parents in public housing. And so again, you mentioned, Dontrell, our youth feeding program, and in case there were people who don't know what that is or when it begins, it starts on Monday. And if you go to our social media, I listed a schedule for the program, Kickstart. They're doing this with us, and we have a schedule where they're going to be at every site every single day. So that's one way to offer a little bit of relief for the parents there who are now trying to feed their kids 3 times a day, which is different from what they're used to. Social media is huge. If anyone from public housing is watching, this is a great opportunity to tell you guys to please follow us, of course, here on Facebook, on Twitter at Housing BHAM, and Instagram, HABD BHAM is the handle. Please, 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 please text this keyword, get your cell phone and text HABD COVID, HABD COVID to 797979. That is our text messaging alert system. And that's a great way for you to get information from us instantly and daily. That's where we're posting stuff every day, social media and through our text messaging alert system. If there's something related to COVID that we want to put out, or something related to our operational changes, those are the 2 really quickest ways to get that information from us. Check your mail, because we're sending letters. So those are the biggest things. And we're also getting help from the Birmingham Police Department. We have a community safety partnership with Birmingham Police, and they patrol our communities every day. So we are getting help from the police to make sure that they are reminding residents, if they're seeing them congregating in different areas, they're just reminding them about the safety of physical distancing. No one's looking to arrest anyone. It's not like that. Our officers are pleasant, but they just want to remind people the importance of that, of course, for their safety. And I think that's about it. Dontrell, I think I touched everything as far as our communications, but we are intentional about making sure we're doing all we can to stay communicated and stay connected with our residents.
Fantastic, thank you. Last question, and then we've got lots of things going on live, lots of questions coming in that folks have. Want to ask Dr. Hamblin, Dr. Beavers, just closing remarks from you all in terms of how communities can stay connected during this very, serious time.
It's ironic, today is the 52nd anniversary of the assassination of Martin Luther King. And toward the end of his life, he painted a vision of the beloved community. And I think that's really what needs to happen now. Love needs to transcend all barriers and just really strive to meet the needs of those in our communities. And one way we do that is just stay connected. I sat down and wrote letters. I haven't written a letter in a long time. Notes or emails, yes, but sitting down and writing some letters and notes to people, just a way of, again, staying connected and letting people know that we genuinely care about them and we want the best. We're Christians, we're believers, we're people of faith, and praying is essential for us. And I just encourage all of us to pray for one another as well. Keep everybody lifted up. Again, especially as Dr. Vickers talked about, our first responders who really are putting their lives at risk, ministering health to a lot of people. We pray diligently for them.
Thank you. Dr. Peters.
Yeah, I think it's important that we all make a concerted effort. We can do things in our own little silos, but until we come together as a unified front, we really have no chance of stopping what is going on. On one hand, a lot of people are tired of being in the house, but on the other hand, we're not doing the things that we need to do to be able to come back out of the house. And so it's going to take a concerted effort between faith leaders, between health professionals, between the Housing Authority, just between everybody that is on this call. COVID-19 affects everyone, regardless of our ethnic background, economical background, our race, our gender, our creed, our color. Right now, it does not matter who's rich. It does not matter who's poor. It does not matter who lives over the mountain. It does not matter who lives in the housing projects. It's literally affecting everyone. So the sooner that everyone can make a concerted effort and not just be concerned about getting it, but be concerned about being asymptomatic and affecting other people. I believe that that's very, very important.
Thank you all so much. Again, just some things that we want to horn in on before questions come out. Physical distancing does not mean social isolation. This is a real and present threat in our community, and it's really going to take all of us coming and working together in order to, what people are saying, flatten the curve, but just really helping each other so that we get through these trying times. So Dr. Fletcher and I are going to kind of go back and forth with some questions that have come in. So there are a couple of questions, I think, for Dr. Vickers that Dr. Fletcher has now.
Thank you, Dr. Allen, and thank you all of you for your remarks. So we have some questions about side effects. For instance, well, someone's wondering what's the difference for those with asthma who have trouble breathing compared to someone who might have COVID? How do you distinguish the two?
So typically when you have an asthma attack, you don't have a fever. And you are usually not, your whole body doesn't completely feel fatigued. You do have a difficulty getting your breath because your airways are clamping down. They're very reactive, and they respond fairly quickly. Sometimes it's severe. It takes a big effort to get a response, but they respond and turned around sometimes in 24 to 48 hours. And so the response, particularly if your breathing gets really bad, can be treated and corrected. It's actually not an injury to the airway. It's if the airway is squeezing and clamping down and narrowing the smaller breathing areas. But in the virus, you've actually damaged those areas. So they won't get better right away. And if they're severe enough, that you require being put on a ventilator.
Okay, thank you, Dr. Vickers. And you gave a really great explanation about what does it mean to have a chronic condition, because these are some of the things that all of us have been really wondering about. So what about people with thyroid issues? Some folks in our audience want to know, is that considered a chronic illness or not?
Yeah, it would fit into those areas of things that we live with. And people who have thyroid, either hypo or low thyroid or hyperthyroid, at some level are living with it. If they've had surgery, they may have now in some ways gotten rid of the side effect, gotten rid of the primary cause, I'd say, but you're still typically on some medication. The impact of someone who has thyroid disease as it relates to getting stressed, if you can take your medication, and fortunately it can be given IV if you were to get sick, you should be able to not have the same risk that might exist with those other illnesses that we live through in our lives that may make it harder in the time of COVID virus.
Thank you, that's very helpful.
Dr. Vickers, there's a question that came in about what percentage of those 60 patients at UAB are African American?
I don't know. It's unfortunate. I would say that we will eventually know as we put together the demographic data of the patients. And that's a problem around the country. The reason I can only tell you about Detroit and Milwaukee is the fact that they have chosen to actually document that. And so one of the things that we have to continually push our healthcare providers to do is to know the demographic data so that we can actually address the least of our communities, because they affect everybody. So those that are most vulnerable are the ones that need our attention, because they actually can be the source where people get better, but also can be the source where the virus continually spreads if we don't address it.
Okay. Dontrell, I have a question for you that was a pre-question that came in, if someone in public housing feels ill or concerned about possibly having been exposed, are there transportation resources, seeing that a lot of residents don't have transportation?
Yes, so we do have transportation resources through our partners. The Housing Authority is not actually transporting individuals or residents to these testing sites, but they are available. That's why it's important that these calls that comes in, so that you can provide us self-reports, we can know those that need those services. So again, yes, those resources are available through our partnerships.
All right, thank you. Another question that's come in on the live feed is, in terms of the new order that was just issued by Governor Ivey, the question is, how should patients handle things if they get, or people really handle things if they get stopped by the police en route to an essential appointment?
The best way to answer that is, and that ordinance was just placed on us yesterday. So I think they did indicate some essentials that you're able to be transported, such as going to your essential job, going to care for someone that is elderly or senior, and it was 2 others, but I think it just justifies that if it's not essential, don't go out.
I'll make a comment. 2 things. One, I know the city, and I'll ask Dontrell to find the vision, but I know the city, and I've seen some prototypes. They actually designed some cars to transport people that actually can protect and keep the drivers isolated and make sure the passenger is isolated as well as they go get testing. So there's a thoughtfulness about how do you get people who may have some symptoms that they're worried about to get there and not create other challenges for people trying to take them. The second is, I think Dr. Allen and Dr. Fletcher know well that there's a website called Help UAB Fight COVID-19 that is a place that if you have symptoms, or even if you're well, that will allow UAB to begin to address who and where people have symptoms and how they're doing. That's going to be really important, not only for Birmingham, Alabama, but it's actually important for the country. So we hope this map can actually be used across the country, but you should hear about it. It's a site, again, I think I'm correct, and Help UAB Fight COVID-19. It's one where you can contribute, ask a short questionnaire, and be counted if you have symptoms and or if you are well.
Right, and I'll put that link in the feed. It's helpbeatcovid19.org. Helpbeatcovid19.org.
Thank you.
You're welcome. Question for, well, this is actually some questions that just came in about testing, and we do have some responses to that. One question was, will there be testing available in the West End area or the Birmingham complex? There was talk about testing being set up at Legion Field. And this is a response from Dr. David Hicks, who's the Deputy Director at the Jefferson County Department of Health, who said, Cahaba Medical Care in the West End is currently testing. There are other private providers that are setting up their own testing operations, but they don't have control. The health department doesn't have control over what private physicians might be doing or private practices might be doing. And additional testing from the unified command structure will be decided upon based on county-wide transmission and data. Another question around testing is, if testing is made available, will walk-ups be allowed? Many people in the West End and other parts of Birmingham do not have transportation, there's that again, but may be able to walk to a testing site. And again, the response from Dr. Hicks was, there's a unified command group that's discussing mobilizing testing to reach more at-risk or vulnerable groups that lack access to testing. So just wanted to make sure we touched on that question.
Dr. Allen, I want to add that we will definitely provide this resource when we package this recording, but there are 4 public testing sites right now. So you mentioned one, the Cahaba Medical Care West End, but there's also UAB's Downtown Drive Up Center, as well as Urgent Care for Children's Clinics and Ross Bridge Medical Center. So these are the 4 private sites right now. And of course, there's talk of expanding.
Question that's come in on the feed is UAB Highlands taking COVID-19 virus patients, and are those patients at that facility as well? Are there any there?
UAB is seeing itself as the Highlands and the university main campus see themselves as a single unit. So yes, the patients are not isolated to either hospital. I would say most of the patients who are critically ill, who are on ventilators, are at UAB main hospital.
Is there, Dr. Vickers, back to you, is there a genetic predisposition that COVID-19 attaches to, such as sickle cell disease, that disproportionately impacts Black people?
Not that we know of. So there is no evidence that it has a propensity or somebody has a special receptor that would allow the virus to be more likely to affect someone else. That's not to say that there may be some unique attributes of people who carry the virus and don't get infected that we simply don't know now. That's a population at some point we certainly would want to study to understand why there is a group who clearly have the virus, but they have no symptoms. We don't know whether it's genetics or whether they had antibodies that happens against that virus. We have coronaviruses every year that cause sort of the flu syndrome. There are multiple viruses that do that. This one is a totally new one that, in this case, COVID-19, it is a new one, or COVID-SARS-2. It is a new one that we have no therapy for, and obviously is a challenge.
We're hearing a lot, Dr. Vickers, about vaccination trials and concerns, especially in the African-American community, with developing vaccinations. Would you mind providing some insight on that for those who might want to participate or not?
Yes, I think vaccinations are really fundamental to manage large populations. They're not very vital or effective for immediate therapy. If you know and have ever seen anybody, but fortunately most of us not, there are 2 diseases that were very prominent in our lives. One of them comes back occasionally, one we don't see. Polio is one, which when that virus was there, it affected people severely. And we still see people who survive polio and they have significant walking disabilities because of that virus. The other is measles. Measles can be very difficult to manage and can sometimes be lethal. But those vaccines have made those diseases of something of the past. The only time you see measles is when a parent decides they don't want their child to get that vaccine. But if they get the vaccine, measles are not something we see in our environment. So the idea of a vaccine for COVID-19 is important because it infects so many people. For every one person who has active measles, that person will infect 8 people. So you can understand why it's so important to actually get a vaccine. In this case, it's 1 to 5, and that's equally bad. So a vaccine has to both get a model of the virus that your body can recognize, but having it in a design that it actually doesn't infect you. So you got to get a model, either a dead virus or some replicated form of the virus or its receptor or some part of its coat put into an injection that would really trigger your immune system to attack the virus if it comes. But because you're going to give this to millions of people, you first have to really make sure it's safe in every kind of person. Children, women who are expecting, older people, you got to make sure everybody can get it. And then even if it's safe, you got to make sure it's protective. You got to demonstrate that actually when you give this thing, that a couple things occur. You can measure an immune response, that there are antibodies being made to it. And then you have to then have some certainty that those antibodies actually will work against the virus. That takes anywhere from 8 to 18 months. The earliest may be 8 or 9. Most likely it's more of 12 12 to 18 months to get a vaccine fully up and ready to give patients.
Okay.
Thank you. That's helpful.
There's a question that came in asking, does UAB have enough ventilators right now? And are they looking at trying to get additional ventilators?
So yes and yes. We do have enough ventilators for now, and have a more than adequate supply in the hospital, and have some that we can bring out of storage. And we are actively pursuing and working with companies to design ventilators to produce another 250 or 500. So we're working very hard to be in a position, if we were to need that many, that we would have them and wouldn't find ourselves in the position that some of our other cities have been in because of the massive surge.
This is a question along the lines of that, the pastors in Dontrell may just want to be thinking about, but it's been said that eventually hospitals may become overcrowded. Medical professionals will have to make life or death decisions about who to treat and save versus who not to treat and let die. What is the likelihood that Black people and poor people will be overlooked for life-saving treatments, and is health insurance a determinant of that? I know that's a big question, but
yeah. So what we've learned from the rest of the world, particularly in Italy, yes, there are times where those decisions are made. We have very good algorithms to determine how sick people are and how severe their illness is, and they're very reproducible. So we can determine how badly someone needs the care. What we can't determine, and we don't have algorithms for, is who will benefit the most from the care. Will a 78-year-old man versus a 38-year-old man, who will benefit the most? And in Italy, they've had to make those decisions. They've had to make the decisions that, an 80-year-old man won't go to the ICU. They'll care for him on the floor, but the 35-year-old female or the 35-year-old man will get the ventilator when they were out. And that process usually requires, it's not just doctors, but in most structured environments, it's a team of people coming together, and UAB has that, which include ethicists, it includes people of color, it includes non-physicians, it includes individuals who have some lay backgrounds, and so you want to get a broad opinion of what should be done from all perspectives of life, so that, because inherently, if everybody who's making a decision looks the same or they do the same thing, they will come out with a biased opinion. I think now in New York, they're very close, as I mentioned to you. I've heard someone say that if you are an older person and you suffer from what people believe is a life-threatening event like a heart attack or a very severe stroke, you might not get an ICU bed, and you might not be taken to a setting where you can get fully resuscitated because of the true shortage they have. That's been a community decision driven out of necessity because they simply have no resources to deal with it. I don't know if that's uniform, but we're far from that being the case at UAB or at any hospital in Birmingham. But we certainly have thought about what that might look like if we had to. Right now, our hospital is normally we run about 92% occupied. So if we had 100 beds, we'd have 92 of them full. Right now, if we had 100 beds, only 50, probably 4 of them are full. So we have a lot of space left because we've stopped all of our regular business.
Thank you, Dr. Vickers. And we have a few more minutes. In the final moments, I would like for Dr. Beavers, Pastor Hamlin, Dr. Hamlin, and Dontrell to just let us know, in the spirit of collective responsibility and collective work, we want to know, how can UAB and other institutions be of assistance to communities during this time? We know it takes a village, what's demonstrated with this call today and this collaboration, So we want to make sure that we're merging those gaps and really leveraging strengths from multiple sectors right now.
I just want to say to our partners, to those supporters, those that are in the audience, any information that you have, any resources that you may have to assist our residents, please reach out to us. We have our HABD board is very supportive of what we're doing. And Commissioner Anthony Hood, who is a huge part of this initiative, what he says to me is, within my role, over communicate, and that's what we want to do. So we welcome all information that you can provide to us and all resources. You know, we just welcome it and just continue to just overload us with all the information that you may have so we can get to our residents to keep them safe in our communities.
Thank you, and thank you for also being a frontline worker. We appreciate everything that you're doing right now. Dr. Beavers?
Dr. Ham can go first.
Thanks, Thomas. I'm bivocational. I work at UAB at the 1917 clinic, which is our outpatient HIV clinic. Been here 17 years, been at UAB 19 years. And UAB has always been a partner in our community, not just in the middle of a crisis, but for ongoing partnerships, trying to improve the health qualities of our communities. And I'm grateful for this partnership. And I think something like this is vitally needed in our community where people can receive credible information from a good resource. And surely Dr. Vickers is a good resource. And I know there are others, and I would just say we need to explore other venues to make something like this happen for other communities. And I appreciate the Housing Authority making it happen as well. But there are other pockets where this kind of information needs to be addressed and disseminated. So I applaud everybody for making this happen today and look for other opportunities to partner to get more credible information out.
Thank you, Dr. Hamlin. Thank you for everything you're doing in our communities.
Yeah, so I would concur with Dr. Hamlin and everyone else. I think timely information and correct information is the key, and I believe that UAB can continue to partner with our communities by doing more things like this. So from my understanding, this is the first of many webinars and the first of many Facebook Live. And I think that's very, very important to continue to do things like this, to continue to have a conglomerate of people on these webinars and on these Facebook Lives, because everyone has a sphere and a circle of influence, and everyone is responsible for using that circle of influence to be able to convey this information. And so I look at myself as a channel and not a reservoir. I've learned so much just from being on this call today. Things that I thought I knew that were inaccurate and things that I did not know at all concerning COVID-19. And now that I've learned it, I'm going to do everything inside of my power to communicate this information to my sphere, my circle of influence, so that we can all come out better.
Thank you, Dr. Beavers. So Dr. Allen's going to close us out.
Sure. We just want to thank everyone for their time, their attention, your quickness in our ask and participating in this. For those who are on the live stream, this literally came together within a week's time. And we know that during this very serious and interesting time in our lives, that we have to quickly move together in order to address this issue. So with that being said, this is a recorded live session. It will be made available later on the School of Public Health's YouTube channel. We want to again thank everyone who helped behind the scenes, those who are a part of the presentation today. As you've heard, this is the beginning, what we hope will be a series of conversations around the community issues related to COVID-19. And again, just want to thank everyone for participating this afternoon.